Hello, 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 YouTube world. It's Miss Patty with 4YourCNA here for our live CNA practice test game show. We do this on the first and third, first and third Tuesday at 11 a.m. each month. So, real quick, can you give me a mic check? Give me a thumbs up because I kind of moved some things around. And I need to know if you can hear me. Can you guys hear me? Can't hear. Okay. All right. Hold on. 1 second. Time out. Sorry, guys. Hold on. Hold on. Okay, let's try that. Can you hear me now? Can you hear me? Hello? Can you hear me? Tell me yes or no. Give me a thumbs up if you can hear me. Yes. Okay, good. Awesome. Sorry guys, it's a long story. Let me tell you a little bit about what's going on here before we get into it. Oh, even better, that's awesome. Okay, let me tell you, so my computer, and I've got a beast of a computer to do all the video editing and all the stuff that I do, all the content creation, but my computer is 6 years old now, so it's not really working all that well. So I had to take it down for service and had to disconnect everything. And if you saw all the cords that are attached to this thing, and I don't do tech, I had to put it all back together. So apparently my microphone, I've got one of these big, I don't know if you can see it, you know, one of these big industrial type microphone things. Well, it is plugged in, but it's not reading, so I don't know. I'm on my little webcam microphone now. As long as you can hear me, we can play. Oh, it's very noisy. I'm sorry, Latchman. I really am. Unfortunately, I can't get my big one to work right now. I'll work on that. I have a brand new desk coming. I ordered a new desk. So once I get everything really loud, noisy today. Okay, hold on. Let's see if I can fix that. Is that better? Is that better, guys? See if that's better. See if that's better. Hopefully. Yeah, I got a lot of tech stuff going on. And my office is an absolute disaster area. So I got to clean all this to put the new desk in. So give me, no, it's not better. Okay. I don't know what to do here. Not sure. Is it good enough that you guys can play? Is it good enough for you to play? And I'll work on fixing it later. Is it good enough to play? Latchman, hi Miss P. I have my exam in a few days. Kindly give me some tips, please. Okay, all right, we're good enough to play. All right, good. Okay, Latchman, go get my ebook. 4YourCNA.com/ebook. Go get the ebook. That will help you on the test. I'm so sorry, guys, about the sound. I am a work in progress. If any of you guys are tech people, hey, hit me up because I need some tech help. All right, so let's get started with today. So today, if you look here, the test plan is going to be on the smallest portion of the exam. It's only 14% of the questions. It's caring for residents with specialized changes in health. And it's going to cover a lot of kind of the psychological, end of life, how we work with our patients, you know, all those soft skills, okay? So it makes up a very small portion of the test, but it's a very important portion. So I'm going to give you some questions that you might see under this heading. So you guys are competing for prizes. I know I'm going to try to limit my talking here because I know the sound is bad. But you guys are competing for prizes. So when the question pops up, you'll on your screen, you will type in the numbers 1, 2, 3, or 4 and hit send. It's only going to read your first one, and it only reads it'll only read it if you just send the number. If you send the number and then words, it won't read it. So just the numbers 1, 2, 3, or 4. So you're competing for prizes, and first place. Latchman, we don't sell a practice test. So I'm not sure who you got that from, but that's not us. We don't sell practice tests. We sell a skills book, and we give away an ebook, but I don't sell a practice test. Oh, Charm! Charm passed! Congratulations! I just see that you're on here, so congratulations to you. Great job, Charm. I'm super proud. Charm let me know earlier this week that they passed, and I'm super, super excited. Okay, so first place is a t-shirt. So this is the class t-shirt. Hey, Helen, I know Blue, and hey, Blue, I did get your email, and I will work those suggestions into some future game shows. So great idea. I know I've got so many big projects going on right now. I'm trying to get back to my Thursday lives, but it's time management is an issue for me right now because I've got so much going on. So first place today, t-shirt. This is the class t-shirt. This is what my students wear. We call it a cheat shirt, not a cheat sheet. Cheat shirt, because on the back, just like what you see on the screen, inside these letters, you probably can't see it real well, but inside the letters are all of my sayings. So this is basically how you pass the test, right on your back. You can get this one, but if you don't want that one, we have some other t-shirts. We have the pink heart, Called to Care. We have the CNA Care Crew, which is pretty popular. We have the Become Inspire Care on black, and you can also get that one in red, white, and blue on white. So I don't have an image of that. But those are the options. We'll go over that again at the end when we announce the winners. Second place gets a card game. This is a CNA Principles card game. It's super, super fun. It's a great way to learn, but it's also great at getting non-medical people interested in medicine. So it can be a great recruitment tool as well, and a lot of fun. And then third place, you get some motivation gifts. You get the badge holder and some motivation keychains, bracelets, and such like that, just to thank you for being an important part of healthcare. So those are the prizes you're competing for. The rules: we are going to display the question for 60 seconds, and I will read it along with the answer choices. You will put in the answer that you want to choose. The numbers 1, 2, 3, or 4. Hit send. Don't put anything else. Just hit the number and send. And YouTube, as it receives those submissions, remember you might see it different on your screen than what YouTube receives it because of transmission time. We award points. Quickest answer gets the most points. So Charm, yes, I know you did your exam last Thursday, and I'm super, super proud of you. Great job. Latchman, yes, we do have flashcards, and right now they're still on sale, $19.99 for the flashcards. Those actually will go up today. So if you're looking to get the flashcards, get them sometime this afternoon, because those do go back up today. All right, so are you guys ready? I'm sorry, Betty. I'm sorry you can't join us for this. Make sure you go back and watch your replays, though. All right. So are you guys ready to start? Here we go. So limber up those fingers. You've got about 25 seconds. I am so sorry, Adalyn. I'm having microphone issues. Maybe, hold on. Let me see if maybe I can do something here. Monitor. I don't know anything about this. Okay, can you guys hear me? Can you hear me? me see. Okay, can you hear me now? Can you hear me now? All right, here's our first question. A resident with dementia becomes agitated during care. What should the CNA do? 1, redirect calmly to another topic. 2, raise your voice to gain control. 3, restrain them gently. Or 4, leave the resident alone. A resident with dementia becomes agitated during care. What should the CNA do? 1, redirect calmly to another topic. 2, raise your voice to gain control. 3, restrain them gently. Or 4, leave the resident alone. Go ahead and lock in your final answer. You've got about 10 seconds left. And those of you who have already voted, if you can tell me, is the sound better? Is the sound better? Let me know. The right answer here is, you guys all got this one right because you're super smart, redirect calmly to another topic. So look at you guys go. You guys all got this one right. I'm super proud. And this happens a lot with dementia. Your patients will get agitated. And one of the reasons that patients get agitated is because coping is required. And think about all the different ways you have to cope every day. Things don't always go as planned. Dinner might be a few minutes late. Your favorite shirt might be in the washer. Somebody doesn't call that you expect to. We have all kinds of issues during the day that we have to cope with. Well, with dementia, our coping mechanisms are affected. So that can actually cause some agitation. Catherine came in first on that one, followed by Helen, Nish, and Christy. Oh, Blue, they are fantastic. All right, question number 2. What is a common behavior in early stage dementia? Common behavior in early stage dementia. 1, full immobility. 2, refusal to speak. 3, inability to recall recent events. Or 4, high levels of alertness. So what is a common behavior in early stage dementia? 1, full immobility. 2, refusal to speak. 3, inability to recall recent events. Or 4, high levels of alertness. Go ahead and lock in your final answer. Got about 5 seconds. And lock in the final answer. All right, the right answer here is number 3, inability to recall recent events. That is kind of the hallmark of dementia. You can recall things that happened long ago, but you can't really recall things that happened in your immediate past, like they may not remember lunch. So full immobility, that's end-stage Alzheimer's. High levels of alertness, not dementia. Refusal to speak. Now, a lot of you put that one. Refusal to speak is sometimes a behavior seen, but it's not really a common behavior in early stage dementia. What this is trying to find out is, do you understand the disease process? And short-term memory is affected rather than long-term. So that's what makes 3 a better choice. So Andina came in first, followed by Christy, Helen, and Christine. Good job, guys. Good job. We're moving on to question 3. A resident with depression refuses to get out of bed. What is the CNA's best response? 1, leave them alone until they ask. 2, encourage and offer help with a small task. 3, force them up for breakfast. Or 4, report them as non-compliant. So a resident with depression refuses to get out of bed. What is the CNA's best response? 1, leave them alone until they ask. 2, encourage and offer help with a small task. 3, force them up for breakfast. Or 4, report them as non-compliant. Go ahead and lock in your final answer. You've got about 10 seconds left. Go ahead and lock in your final answer. The right answer here is number 2. You guys all got this one right, so that you did a good job there. So yeah, with depression, we're going to be very encouraging and positive and uplifting. We're going to celebrate the small wins, and we're going to break tasks down into very small parts, because getting dressed may feel completely overwhelming to somebody with dementia. So we're going to offer help with small tasks, and we're going to build on that. Leaving a depressed person alone does nothing to help their overall state of mind. Forcing them, you won't get any compliance. They'll dig in deeper. And reporting them as non-compliant, this is expected with depression. It goes along. It's not really something that makes them non-compliant for that label. So Christy came in first, followed by Leslie and Dina and Nish. Nish? I hope I'm saying that right. Question number 4. A resident with Parkinson's disease needs help eating. What technique would help the most? 1. Provide thickened liquids. 2. Force them to eat with a spoon. 3. Offer large portions. Or 4. Allow extra time and minimize distractions. So a resident with Parkinson's disease needs help eating. Which technique would help the most? 1. Provide thickened liquids. 2. Force them to eat with a spoon. 3. Offer large portions. Or 4. Allow extra time and minimize distractions. So go ahead and lock in your final answer. You've got about 5 seconds left. Go ahead and tell me what you want to choose. The right answer here, most of you guys got this one right, allow extra time and minimize distractions. This is, it's really important with Parkinson's, because with severe shaking, whatever's on that spoon or fork, most of it is going to be knocked off with the shaking. So we want to allow extra time. You don't want to rush this patient. You also want to minimize distractions in the area, so a nice calm environment. Not a lot of chaos going on that can distract them or shift their focus is the best technique to use with patients with Parkinson's. We do not thicken liquids unless there's a doctor's order for that, and we never force anyone to do anything. And Dina came in first, followed by Viola, Nyash, and Adalyn. Good job, guys. All right, moving on. Question 5. A resident is yelling in the hallway. What should the CNA do first? 1. Yell back so they know how it feels. 2. Put them in a timeout. 3. Remain calm and redirect. Or 4. Restrain them. A resident is yelling in the hallway. What should the CNA do first? 1. Yell back so they know how it feels. 2. Put them in a timeout. 3. Remain calm and redirect. Or 4. Restrain them. This is a very common question on the state exam. You will get some sort of a conflict resolution question on the state exam. So 10 seconds left. Go ahead and lock in your final answer. The right answer here is to remain calm and redirect. Yeah, patients are going to get upset. Remember, they're not at home. Their life took a sudden wrong turn. They are not where they want to be. Their health is not cooperating. They have a lot to be angry about. And if you've got a nice patient, that's a good day, by the way. And sometimes anger is going to come out. Patients may yell, and that's okay. We want to remain calm and redirect their focus. Get them involved in an activity, do something with them, take them for a walk. We want to just redirect that energy. We don't punish patients. We don't yell back. We don't put them in timeout. We don't restrain them. These are adults. So we just want to redirect. Leslie came in first, followed by Catherine, Christy, and Naish. Good job. Question number 6. A resident you have been caring for becomes suddenly confused and does not recognize you. You should, 1, ensure their safety and notify the nurse. 2, explain who you are patiently. 3, continue care as usual. Or 4, collect urine for a urine test. So a resident you have been caring for suddenly becomes confused and does not recognize you. You should, 1, ensure their safety and notify the nurse. 2, explain who you are patiently. 3, continue care as usual. Or 4, collect urine for a urine test. Go ahead and lock in your final answer. You've got about 10 seconds left. Go ahead and lock in your final answer. Nyash, I don't know what that means. Okay, number 1, ensure their safety and notify the nurse. Very good. And a lot of you got that one right. There were some other answers, though, that some of you put. So let's go over this. This question gives us kind of a clue as to what we need to do. It says suddenly. A resident you've been caring for becomes suddenly confused. Anything sudden has to be reported to the nurse right away. That's a change in condition. Explaining who you are does not take care of the confusion. Continuing care as usual does not take care of the new symptom. And ordering urine for a urine test, you might have to do that, yes, but only after the nurse is notified and orders it. So Leslie came in first, followed by Wadani and Adalyn. Good job. Okay, question number 7. A CNA notices a resident wandering into other rooms. What is the best first step? 1, confine them to their own room. 2, gently guide them to a common area. 3, scold them so they know it's wrong. Or 4, call security. So a CNA notices a resident wandering into other rooms. What's the best first step? 1, confine them to their own room. 2, gently guide them to a common area. 3, scold them so they know it's wrong. Or 4, call security. What do we want to do with this patient? Go ahead and lock in your final answer. You've got about 10 seconds left. Go ahead and lock in your final answer. The right answer here, yeah, most of you guys got this one right, is gently guide them to a common area. This is very common with dementia patients. They'll wander in and out of rooms because they really don't know where they're supposed to be or what they're supposed to be doing. So wandering is very, very common. We don't confine patients to their rooms. That's a punishment, and that's not something that CNAs do. We don't scold them. That's a punishment. That's not something CNAs do. And calling security isn't going to help here. This is not a threat. We're going to gently guide them to a common area so that they can be around other people and that we can keep an eye on them so that they're not putting themselves in danger. So with confused patients, a lot of times you'll see them in common areas, usually involved in some sort of an activity. So Viola came in first on that one, followed by Leslie, Chrissy, and Andina. Good job. All right, halfway done. Question number 8. When assisting a resident nearing end of life, the CNA should 1, talk only when necessary. 2, offer emotional support and comfort. 3, feed them every hour. Or 4, play loud music to distract them. So when assisting a resident nearing end of life, the CNA should 1, talk only when necessary. 2, offer emotional support and comfort. 3, feed them every hour. Or 4, play loud music to distract them. Go ahead and lock in your final answer. You've got about 15 seconds left. What do we want to do to assist a resident who is nearing end of life? Go ahead and lock in your final answer. This is a pretty easy one, I know. Yeah, we're going to offer emotional support and comfort. We're going to let them talk. We're going to let them reminisce. We're not going to shut them down. Talking only when necessary is the wrong approach here. You don't want to shut a patient down as they're ending the end of their life. We're not feeding them every hour. In fact, appetite usually diminishes greatly as we near the end of life, so they may not be eating. And playing loud music to distract them is the wrong approach here. We don't want to cause agitation. We want a nice, calm, easy environment that is conducive to conversation if they wish to talk, or just hold their hand. So Yvette came in first, followed by Leslie, Andina, and Viola. Good job. Good job. Moving on, question number 9. Which action should be avoided when working with an anxious patient? 1, touching the patient without consent. 2, describing every step of care. 3, giving limited choices. Or 4, maintaining their normal routines. So which action should be avoided when working with an anxious patient? 1, touching the patient without their consent. 2, describing every step of care. 3, giving limited choices. Or 4, maintaining their normal routines. So read this question carefully, guys. Read this question carefully. You've got about 10 seconds left. Go ahead and lock in your final answer. So which action should be avoided? All right, the right answer here is number 1. Yeah, you guys were kind of all over the place, and you got to pay attention to the wording of the questions, right? So which action should be avoided? That means we're going to do 3 of these, and we're not going to do 1 of these. So which one are we not going to do? Well, we don't ever touch a patient without their consent, but especially if they're anxious, because anxious patients can often react as though whatever is happening is a threat. They're on high alert. So we don't ever touch a patient without their consent. We do want to describe every step that we're taking. We want to give limited choices so they feel like they're a partner in their care. And we want to maintain their normal routines as much as we are able to, but we never touch somebody without consent, especially if they're anxious. Leslie, Nyash, Wadani, and Viola came in. Verse 4. Question number 10. A resident expresses suicidal thoughts. What should the CNA do? 1, understand that this is normal. 2, bring the patient to a common area. 3, explain what will happen to their soul. Or 4, ask if they have a plan. So a resident expresses suicidal thoughts. What should the CNA do? 1, understand that this is normal. 2, bring the patient to a common area. 3, explain what will happen to their soul. Or 4, ask if they have a plan. Go ahead and lock in your final answer. You've got about 10 seconds left. You guys are kind of split on this one. All right, lock in your final answer, last chance. And the right answer here is number 2. We're going to bring that person to a common area, and we're going to get a nurse involved right away. A lot of you put number 4, ask if they have a plan. Guys, that is the role of the nurse, not you. Because as a CNA, what are you going to do if they say yes? You don't really have the next step. So we don't ask, do you have a plan? We get that patient where other eyes can see them, and we go get the nurse right away. Do not leave that patient alone. Suicidal behavior is not normal. And we don't impose our religious views on patients. We don't tell them that your soul is going to be doomed or anything like that. Not your role. Your role is to ensure their safety and notify the nurse. So Andina came in first, followed by Widiani, Helen, and Viola. Question number 11. A resident with COPD feels short of breath. What should the CNA do first? 1, put the head of the bed flat. 2, increase the flow of oxygen. 3, put the head of the bed up. Or 4, give the resident a paper bag. So a resident with COPD feels short of breath. What should the CNA do first? 1, put the bed flat. 2, increase the flow of oxygen. 3, put the head of the bed up. Or 4, give the patient a paper bag. Go ahead and lock in your final answers. You've got about 20 seconds left. You guys are so smart. Look at you go. I am so incredibly proud of my crew. Go ahead and lock in your final answer here. The right answer is, you guys all got this one. Put the head of the bed up. Yeah, if you got somebody that is short of breath, having difficulty breathing, wheezing, can't catch your breath, their color is funny, whatever, get them sitting up. That reduces the amount of pressure pushing down on the lungs and allows that chest cavity to move more effectively, allows those lungs to inflate. So we got to get the head of the bed up. Then we're going to go get the nurse, because this is a nurse problem. So head of the bed up. Don't lay them flat, because somebody that's having difficulty breathing will definitely have more difficulty laying flat. We don't increase the flow of oxygen unless we're specifically told to, and giving a patient a paper bag is not going to help in this situation. That is for hyperventilation, breathing too fast. So Nyash, Leslie, Christy, and Andina came in top 4 on that one. Good job, guys. Question 12. A resident with hearing loss doesn't respond. The CNA should 1. Face the patient and repeat the question. 2. Shout into the patient's good ear. 3. Use a picture board to communicate. Or 4. Assume the patient is ignoring you. So a resident with hearing loss doesn't respond. The CNA should face the patient and repeat the question. Shout into the patient's good ear. Use a picture board to communicate. Or 4. Assume the patient is ignoring you. Go ahead and lock in your final answer. You've got about 15 seconds left. Go ahead and lock in your final answer. Only 3 more to go, guys. The right answer here, you guys are split on this one. You're split on this one. The right answer here is to face the patient and repeat the question. If they're not responding, if we know they have hearing loss and they're not responding, they probably did not hear the question. And if your back was turned to them, they probably did not see that you asked a question. So we're going to face the patient head on so that they can see that we're engaged with them and that we're presenting some information or a question or something that they need to respond to. So facing the patient becomes very, very important when you're working with somebody who has a hearing loss of any kind. Don't shout at a patient ever. That does not help with hearing. Using a picture board to communicate may be indicated, but that would be on the care plan. So we're going to face the patient. That's the right answer here. Christy, Andina, Chrissy, and Helen came in top 4. Question 13. A patient with dementia will pay most attention to 1. Your facial expressions and body language. 2. People using medical terminology. 3. Conversations around them. Or 4. Written instructions. So a patient with dementia will pay most attention to 1. Your facial expressions and body language. 2. People using medical terminology. 3. Conversations around them. Or 4. Written instructions. So what is a patient with dementia going to pay the most attention to? Go ahead and lock in your final answer here. You've got about 10 seconds left. So final answer, guys. And wow, I thought this one would trip you guys up. You did good. Yeah, the right answer here, guys, is number 1, your facial expressions and body language. Now, let's time out here for a second. You have to understand this if you're working with dementia patients. Notice they're not paying attention to your words. They're paying attention to your facial expression and body language. So if you approach a patient with dementia and you're all stressed out because of something else and it shows on your face and body language, they will interpret that as being directed at them. Don't use medical terminology with dementia patients. They barely understand what things mean in English, or they may not at all. So medical terminology will really freak them out. Conversations around them often don't penetrate, and written instructions, written word is usually one of the first things to go with dementia. Your facial expressions and body language will mean a lot to them, though. Leslie, Widiani, Andina, and Christy came in top 4. A resident is nonverbal but moans during care. What could this mean? 1, attention seeking. 2, a sign of pain. 3, consent. Or 4, nothing. This is normal. A resident is nonverbal but moans during care. What could this mean? 1, they're attention seeking. 2, it's a sign of pain. 3, they're giving consent. Or 4, nothing. This is normal. Let's go ahead and lock in your final answer. Go ahead and lock in your final answer. You got about 10 seconds left. This one can be a little tricky. All right, the right answer here is a sign of pain. If somebody is nonverbal, every sound they make could mean something. So we have to stop and figure out what it is that sound means. Because if they're nonverbal, they can't use words to communicate. They have to use sounds instead. So if we're providing care and the patient is moaning, we need to stop and figure out if what we're doing might be causing pain, or if the patient is having pain from some other source. So we're going to look for stiffening or turning away or some other nonverbal cue that something is wrong here. It does not mean they're attention seeking, and moaning is not normal. So Leslie came in first, followed by Widiani, Christy, and Chrissy. Last question. A resident with confusion tries to leave the facility. What should the CNA do? 1, shout at them to stop. 2, remain calm and notify the nurse. 3, restrain them for safety. Or 4, hold the door open for them. A resident with confusion tries to leave the facility. What should the CNA do? 1, shout at them to stop. 2, remain calm and notify the nurse. 3, restrain them for safety. Or 4, hold the door open for them. Go ahead and lock in your final answer. You've got about 15 seconds left, and we're going to talk about this question. So you got about 10 seconds left. Go ahead and lock in your final answer. The right answer here, guys, is to remain calm and notify the nurse. Now, I want to stop here and talk about this, because if you're reading this, there's really no good answer here, because there's no answer that actually addresses the problem, right? We have a patient with confusion trying to leave the facility. So there's no answer that kind of solves the problem correctly. So unfortunately, on the state exam, you're going to have questions like this where you're going to think, well, I don't know if this is the right answer because it doesn't stop the patient from leaving. But number 1, Miss Patty says we don't ever shout at them for anything. So 1 can't be right. We don't restrain them, so 3 can't be right. And we certainly don't want to hold the door open for them. They're confused. So 2 is the only one that could kind of be right, but it doesn't really stop the patient from leaving. So remember that there are hard principles that you cannot overcome as a CNA. We do not restrain unless we have a doctor's order. We do not shout or punish or treat an adult like a child, no matter what. So when you keep these things in mind, it helps you eliminate some answers. Now, I left this question in on purpose because it's one of those, this answer might work, but it's not a good answer. And you may have some questions on the state exam like this, where the answer you choose might be an okay answer, but it's the best best one out of the ones that are presented to you. Now, when you go on for nursing, those of you who are looking to move past CNA and go into nursing, this is about 50% of the tests that you take will have answers like this, where there's no real good answer. You're just trying to find the best answer out of the choices presented to you. So this is kind of a taste of what you might see if you go on. But you will have one or two of these on the state exam as a CNA as well. So I hope that helps you. Leslie came in first on that question, followed by Chrissy, Naish, and Viola. So we're going to get our total scores here. First place, Leslie, you get a t-shirt. Second place, Andina, you get a card game. And third place, Christy, you get a badge holder. So congratulations to all of you. Great job. I'm super proud. Congratulations to all of you. So Leslie, let me put this in my chat here so you guys can see. You guys are all going to send me your, through email, you're going to email 4YourCNA@gmail.com. Tell me what place you came in, your screen name, and your name and address so we can get these prizes out to you. So first place, you're also going to give me which t-shirt you want and your size. So let's go back to our prizes so I can show you. Second place, you're getting the card game. So first place, Leslie, you can choose from Pink Heart. You can choose CNA Care Crew. You can choose the class shirt or Become Inspire Care. So you can decide which one of those that you want. And remember, we do have the Become Inspire Care in red, white, and blue on a white shirt as well. I just don't have a picture of it. So you want to choose one of those four. So Pink Heart, CNA Care Crew, the class t-shirt, or Become Inspire Care where CNA is outlined. So make sure you tell me which shirt you want and your size, and we'll get those put together. We actually make them in-house and ship them out to you. So those usually will go out the next business day. So we try to get these out to you pretty quick. Helen, I'm not sure, to be honest with you, at the moment, what the cost of my practice kit is. But if you go here, I'm going to put the courses.4YourCNA.com/shop. Go here to buy the practice kit. If you click on it, you'll see all the things that we offer for sale. You can click on the practice kit and the price will be up there for you. That practice kit has everything you need to practice. So the gait belt, the graduate container, a urinary drainage bag, chucks, bedpan, bath basin, emesis basin, everything you need to practice is in that bag. Even a privacy blanket we include. It's a nice carrying bag too. So hopefully that will help you as well. I hope you guys had fun today. I had fun hanging out with you. This is like the highlight of my week. I love doing the game show. So the next one will be in 2 weeks. So the third Tuesday of the month. So in 2 weeks, we'll have another game show, and I hope to see you there. Tomorrow we have class 4. We're at the halfway point of our latest class session. And guys, if you have a chance, kind of cross your fingers for me. Send out some good vibes to me as I try to clean my office for my new desk. And if you guys, once I get it all done, if you guys want like a behind the scenes sneak peek of where I spend all of my time, let me know, and I'd be happy to maybe jump on here on a live and kind of show you my little domain, my office. So if you're interested in seeing something like that, just let me know, and I will I'll hop on a live and we'll do that together. All right, guys, so thank you so much for hanging out with me today. I truly love our time together, and I hope you have a fantastic day. Until next time, happy caregiving. Bye.